Thank you. Thank you very much. I'm thrilled to have such a wonderful crowd today, and we're thrilled to be testing out our distance learning connection with our friends in Laredo. The program we're going to be doing today is called A Living History. Sharon mentioned I manage our ongoing oral history project. Since the museum opened back in 1989, we've recorded nearly 1,000 interviews with individuals that remember the Kennedy assassination and can reflect upon the life, death, and the legacy of President Kennedy. And every so often we encounter a really extraordinary storyteller. And we like to invite those folks to come in for a program where we get to do a live oral history before an audience, and then let our audience members become oral historians for a few minutes and interact with our participant. And you're in for a real treat today because we have with us registered nurse Phyllis Hall, who was at Parkland Memorial Hospital on the day of the Kennedy assassination. We're going to cover a lot of ground today. She started at Parkland back in 1957, and at different times during the course of this story, she had interactions with the Oswald family, with President Kennedy, with Governor Connolly, and then later with Jack Ruby. So we have a lot to cover today. It's a very exciting story. We have some photographs we're going to share with you, and Phyllis brought some memorabilia to share as well. So I hope you will join me now in welcoming registered nurse Phyllis Hall as our guest today. So Phyllis, let's start with 1957. You joined the staff of Parkland Hospital, and this is what you looked like. This is your photo, your graduation portrait,
Pretty
correct?
cute.
Oh, exactly. Oh, absolutely, and still is. You haven't changed a bit in the last 50 years. The Parkland Hospital was a major trauma center in the early 1960s, and you started in the emergency room.
That's correct.
But at the time of the assassination, you were in the outpatient clinics.
Right.
Give us a sense of what the difference is for folks that maybe aren't familiar with the way a hospital functions.
Okay, well, I started in December of 1957, a newlywed just back from Illinois, and had a friend working there in administration. He said, "You've got to come and work here." And so I said, okay. And I started working there. I worked in the emergency room full and part-time for 4 years. And once my children started participating in school projects and things, I decided to switch over to the outpatient clinics, and that was where I was working in the OB gynecology clinic. The surgery clinic, on that day in November. And I had taken my lunch break and was over talking to my friend that was working triage in the emergency room that day. And if you'll excuse me, all hell just broke loose. And I thought the communists had taken over. I thought we were going to be blown up. And, you know, I was just terrified. But I stood at the triage desk, and the first person I recognized coming through the back hallway there was Mayor Cabell and Mrs. Cabell. And then next on my TV screen, this is what it seemed like then, was President Johnson, and one of the residents working in the pit, as we call the emergency room, thought he was having a heart attack, so he was trying to get him up on a carriage. But they whisked him on back, and then next came Governor Connolly, who had been really badly wounded, and every time he was screaming pretty loud, and I don't blame him. But every time he would breathe out, this mist of blood and fluid would come out of that lung that was punctured. And they put him up in the room close to me. Then next came this man in a white shirt with the biggest gun I've ever seen in my life. He was holding it up like this, and I mean, it was huge. And he looked over, and he came over where I was, and he took me by the arm, and he said, "We need you back here." So I wasn't going to argue with him. I just went. And ended up back there in Trauma 1. I was the first nurse back there, and previously, let me backtrack just a bit, the emergency room was being redone at the time, so the supervisor's office was on the Harry Hines side, Doris Nelson. And she had just come back to the triage to tell us that there had been an accident in the motorcade and they were on the way. Well, they were there by that time. So in that emergency room, of course, you can't imagine how different it is from all the modern setups they have today. There was no EKG machine. You had to call a special service to come down and do that. And we didn't always, excuse me, always use IVs. There was a defibrillator in the room, and back then the defibrillators were about this tall and about this big, so trying to get it rolled over to the table was something else. But just looking at him, I mean, there was no life there. He was just as gray as a blackboard, and huge hole here, and everything was gone inside the cranial cavity, most of it on Jackie. And but anyhow, we went ahead and did things that would do for people who still were breathing or had a pulse, which he didn't have. And a endotracheal tube was put in. And so I was thinking I needed to get back to the outpatient clinics to start my afternoon clinic. Not thinking that everything in the hospital was shut down. But I guess I was in that room about 20 to 30 minutes. And by that time, there were so many doctors and the CIA and the Secret Service. And some of the CIA and Secret Service were physically abusing each other in the hallway because each service wanted to stay with the body. But anyhow, I did manage to slip on out of that emergency room. And as soon as I got out, Doris Nelson, the supervisor, said, "Would you mind going up and helping get Governor Conley ready to go up to surgery?" So I went up there and helped get him ready, and was one of the nurses that took him up to the operating room. So
wow, it's an extraordinary story. I want to go back and get a little more detail, okay, though, because we sort of flew through that. First of all, let's establish what your mindset was that day. Were you aware that President Kennedy was going to be in Dallas?
Oh, very aware. Yes, we had been aware since I think September was when we found out, the media found out that he might be coming this way. So,
was there any awareness at all that if something were to happen to the president, he'd be taken to Parkland? I can't remember. Well, I knew that any bad accident usually would come to Parkland, so that wasn't something, though, that I thought of. Mm-hmm. I think you told me a while back that initially, when all the activity was taking place at the entryway to the emergency room, someone thought that a woman was having a baby. Can you talk about that?
There was a resident, OB gynecology resident, and they were the closest to the entryway to the emergency. And if you heard someone yelling, that usually meant that a woman was having her baby out in the car. And the ambulances at the time, of course, they weren't equipped to do anything other than just haul the people there. So, and some of the ambulances like to put, it was like instead of notching your gun, you notched the ambulance for how many kids you'd had delivered in the back of your ambulance. So this Dr. Midget was this resident's name, and we have set up in that area what we call precipitation trays, and they're just trays set up with scissors to cut the umbilical cord and clamps and umbilical tape and a few other things. So he just plopped one of those on the carriage and took off out the back door. Of course, he gets out there and here's all this mess. And Jackie, at that time, was still out there. They hadn't brought any of that in yet, and she was leaning over his head. And Dr. Midget had played football for that coach up in Oklahoma, that Bud Wilkinson. So he was huge. He was like a linebacker. And he just picked Jackie up and set her out. And then he just scooped the president up and put him on the carriage and came into the...
If it had been anyone else, any other patient coming into the emergency room with that devastating a wound in their head, would such efforts have been made for that person, or was it special because it was John F. Kennedy?
Well, of course, every patient was, we tried to get vital signs on every patient, but, and we did on him. But any other patient, we would just pull the sheet up.
If something like this were to happen here in 2012, and a person were to go to Parkland Hospital with a wound like that, would there be any chance today of saving that person's life?
No, because there was very little brain tissue left. Like I say, he was
So even though the technology's changed, it
his pupils were fixed and dilated, and his eyes were just half open and mouth slightly open and head turned slightly to the left. And
well, Trauma Room 1 is what the photograph you see up on the screen there, and it's a very small room. We have two pictures of it from different angles, and I'm going to show both of them so you can get a sense of really how small that is. Using the bed, you can tell how small that room is from wall to wall. And there were
actually it's about third larger past the cart than what they're showing in that picture, because back there in that right-hand corner was where the big defibrillator was.
I see. I don't know how well you can see the pictures here, but if you could maybe point out what some of this equipment is. That's a suction machine, if I'm not mistaken?
Yes, this is an old Gomco suction machine. If any of you are as old as me or go back that far, you'll know about Gomco. They had all the equipment. And this is just full of dressings and equipment to tie off little bill eaters, and there's an IV pole, and this is a breathing machine. And like I say, you walk in that and you walk in once there today, and it's just amazing.
And there were 12, 13 physicians in there at the same time trying to get access to the president?
Well, I don't know how many. Of course, they kept coming in as the news got out that there was this emergency down there, but like I say, we were having to try to keep the CIA and the FBI out of there.
What was the atmosphere like? Was it orderly in terms of treating the president? Chaotic?
Yes, very chaotic.
At any moment, did it register with you the historical significance? This is not just a patient with a gunshot wound. This is the President of the United States?
Well, I realized that it was the president. Like I say, it was just sort of like watching a newsreel on TV. You knew all these people were, but they were so out of context. So it was, I guess it was when they were showing the train go across the United States carrying the body that all of a sudden it just hit me that, what I'd seen and what had happened. And
were you a supporter of President Kennedy?
I'm very conservative.
Okay. When you were pulled out of the trauma room to see about Governor Connolly, to help get him prepared for his surgery, he was over in Trauma 2 across the hall. Had the president already been pronounced dead at that point?
No, he wasn't in Trauma 2.
Connolly was briefly in Trauma 2 before he was taken up to surgery. I'm pretty sure about that. Where do you remember him being? Because that's important.
As you come in, the triage desk was here, and they had some rooms set up. It was either right before the triage desk or right after. And I think it was just before, because I took him from that room right to the elevator.
So you don't remember him being in trauma room number 2?
No, that was even smaller than trauma 1, and it didn't have a lot of equipment in there.
Now, in terms of getting him prepped for surgery, what exactly did that involve? What was your role in that?
Well, just, of course, getting his clothes off and trying to get pressure on the wounds and to get him calmed down a little bit. And like I say, the nurses that were up there before I got in there had taken care of most of the things. It was only 5 or 10 minutes before we took him up to the operating room.
Okay. All of this is happening, and you're not even assigned to the emergency room. You're in the outpatient clinics, and you just walked over to the emergency room to go to lunch. And so this is all happening. Did it occur to you to try to reach out to your family? You had 3 kids at the time. 2 of them were in school.
Well, they were in kindergarten. And yes, because I didn't know what was going on, I would have liked to have called my husband, who was working in Oak Cliff at the time, was only 2 or 3 blocks away from the theater. And back in those days, and this always just amazes younger folks here, if we were lucky, we had 2 landlines per unit, 2 landlines. And the media had come in and taken over those, and the ones that they hadn't taken over, the CIA and FBI had taken over. And the last group I talked to, one of the children did say, "Why didn't you use your cell phones?" I love kids.
We were looking just a moment ago at the scene outside of the emergency room entrance. There we are, and then the reaction that some of the bystanders had to the news of the president's death. Did you have any awareness of what was going on outside of Parkland in that ambulance bay?
No.
I
was just inside, locked inside about.
You mentioned to me that you had to get special clearance in order to continue to work at Parkland. In fact, a part of your montage here, you have a Civil Defense and Disaster Commission card of Texas, and that was issued to you the day of the assassination. Tell us about that.
All the employees had to stay that evening until we passed clearance and was issued this card because Governor Conley was going to be there for several weeks. He was badly wounded, and so as long as he was there in the hospital, we had to have that clearance come and go every day. You know, we were seeing the policemen and everything that saw us every day, but they had to check our security. Another
interesting artifact here in this montage is an interoffice memorandum, and it's dated the 27th of November, '63, and I want to read a portion of it because I think it's very telling about exactly what Parkland Hospital represented the weekend of the Kennedy assassination. At 12:30 p.m. Friday, November 22nd, President Kennedy and Texas Governor John Connally were brought to the emergency room of Parkland Memorial Hospital after being struck down by the bullets of an assassin. In the intervening 48 hours between the shooting of President Kennedy and then the shooting of Lee Harvey Oswald, Parkland Memorial Hospital had, and then there's a list, became the temporary seat of the government of the United States, became the temporary seat of the government of the state of Texas, became the site of the death of the 35th president, became the site of the death of President Kennedy's accused assassin, became the site of the ascendancy of the 36th president, twice became the center of the attention of the world, and continued to function at close to normal pace as a large charity hospital. That is quite a memorandum. Looking back, almost 50 years later on that weekend, how does it make you feel? You were right there at the epicenter of this very historic moment. How do you reflect on that? Well, it's a pretty humbling experience, and you know, I'm just kind of awed every once in a while. Still can't believe that I was part of history. Can I give a little bit of my background? Absolutely, please. Well, I grew up in Oblong, Illinois. Now, I want you to remember that name because it's a wonderful little town with camping and stuff. And when I left there to go into nurses training in 1954, there were 1,300, a little over 1,300 people there. It's a farming community. And when I finally left to come to Texas with my new husband, it had grown to 1,500. So when I'm visiting back there, still know many, many people, and they know me, and they're almost humbled, almost on knees, saying, "You were really there taking care of the president?" And that's what really gets to me. And a negative thing, I'm too young to be a museum piece. Sometimes I feel the same way. So. Your story doesn't really stop there, though, because prior to the assassination, while working in the outpatient clinics, you encountered the wife of the accused assassin, Lee Harvey Oswald, during her 9th month of pregnancy. Tell us that story, Marina Oswald. Very, very pregnant. Very, very pregnant. And she had not had any prenatal care up to that point, and she was living the time out in Irving with Ruth Payne in South Irving, and so Ruth decided she needed to get some prenatal care. So the nurses in the OB gynecology clinic were really interested in hearing someone speak Russian. So I got to be in there with her, and it was very interesting. She was a registered pharmacist, very educated in Russia, but you know, she couldn't work here because she wasn't registered. And she was a nice patient. Miss Payne did the speaking for her, and it was only a few days until that little girl, her little daughter, was born. And another thing, and this is just hearsay, but one of the nurses that works up in the was working up in OB-GYN at the time, said there were 3 entries. Now I don't know what the first, second, third were, but anyhow, it was Oswald, Kennedy, and Johnson.
were the babies born, one after the other. So I just thought that was really...
Oswald being the Oswald baby, but the
Right.
other two having the last name
Right, the
Kennedy and
names, but
Johnson.
not...
Wow. When did it occur to you after the assassination, after Lee Harvey Oswald had been arrested, when did you make the connection that you had treated his
Well,
wife?
I guess immediately.
Were you ever questioned by law enforcement or interviewed by the FBI or anything like that?
No, not directly. For some reason, names and addresses and phone numbers on employees there got out. So we received crank calls, and I received one letter. There were other nurses that received more than one letter, but they had to be we turned them into administration, and I guess the FBI or CIA took them. And
You haven't talked about this for many years. It was only the last 5 or 6 years that you've really come forward. And as we've discussed earlier, there are lots of lists listing the various personnel that were in the trauma room with President Kennedy, and your name doesn't turn up. And that's because, of course, you weren't assigned to the emergency room. You were at the right place at the wrong time, or however you want to look at it. Have you been concerned? Have you been worried about speaking out, about telling your story over the years?
yes, I was concerned for my family. I mean, I knew that I could be in danger, but of course you're always concerned about your family. The crank calls were very threatening, and the letter threatened my family and my husband. Well, that's part of my family. But anyway, the letter would say, you know, well, he's not really dead, he's just in vegetative state on one of the top floors there in the hospital, and you moved him somewhere else, and that was sort of the content of the letters.
After the president died, the governor was released, Lee Harvey Oswald came to the hospital and died. You weren't there for that, but how long did it take Parkland to get back to normal?
Well, I don't think very long. Just as a little sideline, I was having a real gallbladder trouble. So I was scheduled to have surgery there. They didn't carry insurance on patients there at the time, but you got a 35% discount on your bill. So I had picked Dr. Mac Perry, to do my surgery, and Dr. Carrico was going to assist him. So we'd get it on schedule, they'd get called to Washington. So then they'd have to take me off, put me on another schedule, they'd have to go to Washington. So this went on for a while.
And of course, Dr. Carrico and Dr. Perry, those were two of the very key physicians that were there with President Kennedy treating him at the time of his death. Now, there's one other very interesting and somewhat humorous aspect to your story. You encountered Jack Ruby. Jack Ruby, of course, went to Parkland and died there January 3rd, 1967, but you saw him before that during one of his...
You mean when we went to see Candy Bar?
Well, we can get to that, but I meant when you saw him at the hospital, because he had injured himself. Tell us about that.
Yes, he would get really tired, I guess, of being in the jail cell, and of course we would learn later that he did have a brain tumor. Sorry, Jack. But, let's see, senior moment. Okay. So he would do things at the jail to hurt himself just enough to make himself bleed or do something, so they'd have to bring him out to Parkland to be checked over. And this one certain day, he had stood on one side of his jail cell, which I don't imagine was very wide, but he put his head down and rammed into the wall on the other side. So I was going back through x-ray that day, and he was back there, and he was just laughing and talking, you know. He wasn't really hurt, but at least he got out of jail for a while.
And you had encountered Ruby before, or at least you had been to his club before.
That's right.
What can you tell us about that?
Well, my husband drove me down there. And I had to hang on to his ear to keep, when Candy Bar came out. How many know Candy Bar? I figured not too many. That's way long time ago. But she was a strip teaser and a pole dancer. Very good, very beautiful. And so, like I say, I had to get my husband by the ear when she came out to dance.
You have had quite the interesting life and career. We've only scratched the surface of it today. You've been telling me stories just since you arrived this morning that I had never heard before, and we've had several of these encounters together. But I want to give our audience the chance to interact with Ms. Hall for a few minutes. We record all of these programs for the Oral History Collection, so if you speak, you'll be part of the archives here forever and ever. Like Ms. Hall, a piece of the
You
museum.
may be sorry about that.
Okay, thank you very much, Nurse Hall, for giving me your recollections of the dark weekend in Dallas. One thing you guys didn't touch on, do you remember Father Oscar Huber with the last rites? There was,
Well, I wasn't in there at that time. I had already left the room, but yes, I did know him because we would call him out at other times when we knew patients were probably not going to live from their injuries or illness or whatever.
Thank you very much.
I see a question, young man right back there who has a question. We'll bring the,
That's my friend.
your friend. Oh, well,
That's my
excellent.
friend.
Well, right back there, yeah. We'll get the mic over there so you can ask your question.
Do you believe that there was another sniper on the grassy knoll when he was assassinated?
Yes, I do.
And what makes you think that?
Because I don't go along with the theory that Oswald was the only one involved with the shooting. He was very good. I know that in military he had his specialty medals, for being a sharpshooter, but I'd have to look over my notes. But I don't think the bullets came from the same direction.
Now, based on you have you had the rare opportunity to be there with the president to see the wound in his head, which the medical evidence is so controversial and remains so to this day. Based on the wounds, the placement of the wounds that you observed, could you tell if the shots had come from the back or the front based on your observations?
Well, since this whole section of his head was gone, and this was the section that would have been towards the school book here, I don't see how the bullet could have gone this way and this been blown out. It looks like to me it would have had to come from the knoll or...
Meaning that this would have been an exit wound as far as you were concerned?
Like I say, it was about that big, just nothing there, no brain tissue in the cavity. Most of it was on Jackie.
Speaking of Mrs. Kennedy, I know she was there. What can you tell us about her expressions or anything she may have said?
Well, of course, she was shocked. Anybody would be, but I mean, not just the wife, but all the people around there that had witnessed it couldn't believe what they'd seen. And so the only time I heard her speak was she was never left him or never left the gurney that he was carried in on. She just stood at the bottom of the gurney with her hand on his foot, and Miss Nelson came in and asked her if she wouldn't like to have a chair out in the hallway, and she said, "I'm not leaving him." So that's...
Do we have any questions for Miss Hall? Any other questions? Yes, back there.
When you saw the throat wound, did you think it was... With the throat wound he had, did you even try to treat it, or it wasn't even looked at? And if it had just been the throat wound, do you think he would have survived?
Well, actually, it was a good entrance for the tracheal tube, and that's what happened. They had to do a little work on it to get the tracheostomy tube in there. So does that answer your question?
Well, if he had not been shot in the head, if it was just the throat wound, do you think he could have survived?
Possibly.
Do we have questions from the distance learning folks, Sharon?
I'm sorry to say that we lost connection with Laredo, and so we'll have to try again with them at some other time.
They got tired of us.
But we do have some folks in Fort Worth that are watching us.
Oh, good, good. Okay, we have a question down here next. Yes, ma'am.
I want to thank you for being the nurse that took care of the President of the United States, especially Jack Kennedy. And a senior moment again. I'm just so thrilled to be talking with you and to have it validated that you also think that there was more than one conspirator. Thank you very much.
You're welcome. Thank you.
Question right down here in front.
Thank you, Ms. Hall. As far as you know, since the assassination, has there been a lot of medical updating of training of emergency staff in cases like this? Or has it changed medical education?
Oh, definitely. You know, going back to crucifixion of Christ, there was nothing there, you know, they could have done for him, but there was something we could do for Kennedy. I mean, very little, but today, you know, it's just, and I've been retired now for almost 11 years, and I still talk to paramedics and things, and the things that they carry on their units and everything, you know, I'm just amazed at. And one thing that always helps the medical field are wars. That's sad to say, but you have to, you know, you have to do things out in the field with whatever is out there. And so medicine is always better after a war.
And when the president travels, it's my understanding that his medical history and relevant files are sent to a hospital which is determined absolutely ahead of time, and they are on standby. That wasn't the case, obviously, in '63. No one really knew to prepare for the president's arrival.
Well, the
until he was on
president
his
was
way.
not well. You know, he had Addison's disease, and he took a lot of medicine and wasn't able to stand a lot, needed a special rocking chair, and so those things we would know probably because they ended up in the media or medical journals, the New England Journal of Medicine or something. So the doctors try to keep abreast of everything during that.
Yes.
I have two questions. One,
Oh, we can just pass the mic. Okay, I'm sorry. We'll get to yours, I promise, both of them. Yes.
quick question. Did the doctors give Jackie any type of medication for, you know, the trauma that she was experiencing?
Not that I'm aware of.
Yeah, the question was, did the doctors at Parkland give Jackie any medication for what she was experiencing, the shock?
You know, back then we depended on ourselves to get us through things like that. We didn't always hold out hands for medicines, but that's a whole nother story.
I have a two-parter. One is, I heard that President Kennedy was wearing his back brace, and that if he had not been wearing it, it might have made a difference in his survival because of where the bullet and how he would have gone into the car. And two, was there conflict on who would do the autopsy between the staff at Parkland and in Washington?
He wasn't turned over when I was in there, so I don't know about the back brace.
Let me just quickly repeat the question because we're not picking it up on the mic. The question was, did she remember seeing President Kennedy wearing his back brace that day? And the other question was about the conflict over the president's body, whether or not his autopsy was going to take place by Texas law at Parkland, or what actually happened, it was taken back to Air Force One, and the autopsy was performed at Bethesda Naval Center that night. You didn't see the back brace, but regarding the autopsy, were you aware of the controversy there?
Yes. The body should not have left Parkland Hospital before the autopsy was done. I think that's kind of a law.
It is. Texas state law at the time, yeah.
Right.
It was a $10 fine.
So that, you know, there was a big controversy brewing, but they had the O'Neill Funeral Home to back up, and they were starting to take the body out, and then they take it back in room 1. Now, I'm told this. I didn't witness that. But, and I'm not too sure that you should totally rely on the Warren report. I don't know if I'm supposed to say that or not.
You can say whatever you'd like.
But the body was tampered with, I think, before it got to Bethesda and after. Because I read some of the report back then, and I thought, this is not right, this is not how it looked, and, you know, we didn't do this, and I don't know that we'll ever know.
We have a question over here. Yes, sir.
Conley, he was sitting in front of the president.
Right.
His wounds, were Are they from the back, front, and what was his wound?
It seems like to me, of course, like I say, they had already been taking care of him, so I wasn't up there initially in that room. But the bullet, I think, entered from the back, went through the chest and this wrist.
You mentioned earlier when the governor first
Were you
was...
through?
Where do you think that bullet came from? The book depository or the nose?
No, I don't think it came from the depository.
You mentioned earlier when the governor was wheeled in, you saw a mist of blood come up from his chest. Can you go into a little bit more detail about what would cause that?
Well, the medical terminology is he had a hemopneumothorax, and what means is the chest cavity had been entered, and there's a little sac that goes around the lungs to keep them inflated, so everything kind of works together. And once that sac, the pleural sac, you ever had pleurisy? Okay, well that's what gets inflamed, this little sac. This is your medical test today. But then when the bullet continued through his lung, of course, it has a massive blood supply. So when he would breathe in, it was sort of like this. And then when he would try to breathe out, it was just all this blood and pleural fluid that was just forming a red mist everywhere.
We have time for about 2 more questions, and then I know that Ms. Hall will linger if you'd like to talk with her. We have a question right
White
over here.
Station High School has a question.
Oh, excellent. Our friends from Memphis, please.
Did you get to speak with the governor once he got better, and did he have anything to say about the incident?
No, he about every week or so, once he was able to be up and around, they would bring him to the cafeteria and do a news program with him. But no, I did not talk to him. And I don't, of course, at that stage, I don't think he would have had any idea how many bullets, what kind, or from what direction.
And one last question before we wrap up today's program. One question right here, second row.
Before they didn't have resuscitation teams, did they ever get any kind of a cardiac reading or cardiac sound?
There was none.
Question was about the cardiac reading.
You know, of course, immediately I felt his pulse, not only the radio, but down by his foot, and just wasn't there. He was gone.
An extraordinary story, a moment in history, and you were present for it, and we want to thank you for taking the time to come to the museum to share your story with us. Please join me in thanking Senator Hall.